I want to talk to you today about something that a number of older adults notice and find puzzling and unsettling, and that genuinely deserves attention: getting out of breath while talking or eating. Two things that should take no real effort at all. You're partway through a sentence and find you have to stop to catch your breath, or you can't get a long sentence out in one go. You're eating a meal and find yourself becoming breathless, having to pause, feeling winded just from the act of eating. And because talking and eating seem so effortless, becoming breathless doing them can be both confusing and worrying. So today I want to explain why talking and eating can leave you breathless, what it can mean, the range of causes, why becoming breathless on such light activity genuinely deserves to be checked, the warning signs that need prompt or urgent care, and what you can do. And while I'll keep this calm, I do want to be clear that breathlessness on something as light as talking or eating is a meaningful symptom worth taking seriously and getting evaluated, because the causes often matter and are frequently treatable, and because it can also touch on swallowing safety, which I'll come to. Let me start with why talking and eating can leave you breathless, because understanding it shows why it can signal something. Breathlessness, that sense of not getting enough air or having to work harder to breathe, happens when your body struggles to get enough oxygen or has to work harder to do so, as I've discussed. Now, talking and eating do involve your breathing in subtle ways. Talking requires you to control your breath as you speak, coordinating breathing with words, and eating requires you to coordinate breathing with chewing and swallowing, briefly pausing your breath to swallow safely. In a healthy person with good breathing reserve, these take no noticeable effort. But if your breathing capacity or your heart's pumping is reduced, then even the light demands of talking and eating, and the breath coordination they require, can exceed your reserve, leaving you breathless. So becoming winded on such light activity suggests your breathing reserve is genuinely limited. Eating adds another factor. It diverts some blood to digestion and requires coordinating breathing with swallowing. And a full stomach can press up and make breathing feel harder, so eating can be a bit more demanding than it seems. And importantly, becoming breathless specifically with eating can sometimes relate to swallowing difficulty, where the coordination of breathing and swallowing is impaired. So getting breathless talking or eating suggests limited breathing reserve, since these light activities shouldn't tax a healthy system. And breathlessness with eating can also touch on swallowing, which is exactly why it deserves evaluation to find the cause. Let me walk through the causes because they're important and often treatable, which is why finding the cause matters. Becoming breathless on light activity, like talking or eating, points, like breathlessness generally, to the systems that deliver oxygen, the heart, lungs, and blood. First, heart conditions. As I've discussed, heart failure, where the heart doesn't pump efficiently, causes fluid to back up into the lungs and causes breathlessness, which when significant can occur even on light exertion or at rest, often with fatigue, ankle swelling, and breathlessness lying flat. And other heart conditions cause breathlessness too. So the heart is a leading cause, and these are treatable. Second, lung conditions. COPD, common in smokers and former smokers, causes breathlessness that, when advanced, occurs on minimal activity. And other lung conditions, asthma, infections and others, cause it. So the lungs are another leading treatable cause. Third, anemia. As I've discussed, a low level of red blood cells means the blood carries less oxygen, so even light activity leaves you breathless, along with fatigue and paleness, and anemia is common and treatable. So heart conditions, lung conditions, and anemia are the leading causes of breathlessness on light activity, all of which need and often respond well to treatment. The fact that you're breathless on something as light as talking or eating, rather than only on real exertion, suggests the limitation is significant, which is all the more reason to get it evaluated. Let me give you the other causes, including the swallowing angle for eating. Other causes include significant deconditioning, being very out of shape, though becoming breathless on talking or eating suggests more than simple unfitness, and shouldn't be assumed to be just that without checking. Being very overweight, which can make breathing harder. Anxiety, which can cause breathlessness, and a sense of not getting enough air. And other conditions. And specifically for breathlessness with eating, there's the swallowing dimension I mentioned. As I've discussed, swallowing can become less safe with age and certain conditions, and if food, drink, or saliva goes down the wrong way toward the airway, it can cause coughing, choking, and a breathless, distressed feeling during eating. So becoming breathless, coughing, or choking while eating can be a sign of a swallowing problem, which matters because of the risk of food or drink getting into the lungs. So breathlessness with eating can come from limited breathing reserve, from the demands of eating, or from a swallowing difficulty. While breathlessness with talking points more to limited breathing reserve, from the heart, lungs, or blood. The reason I emphasize getting this checked rather than assuming it's just being unfit is that the leading causes, heart and lung conditions and anemia, are important and treatable, and the swallowing angle is a safety matter. So evaluation ensures a treatable or important cause isn't missed. Now let me be clear about the warning signs that need prompt or urgent attention, because some breathlessness is an emergency. Seek emergency care right away for sudden, severe breathlessness, breathlessness with chest pain, pressure, or tightness, which could signal a heart attack, breathlessness with blue lips or face, gasping or struggling to breathe, breathlessness with fainting or collapse, or choking that obstructs breathing while eating, which is an emergency, and see your doctor promptly, soon rather than waiting, for new or worsening breathlessness on light activity like talking or eating, breathlessness with ankle swelling, fatigue, or breathlessness lying flat or waking you at night, pointing to the heart, breathlessness with a persistent cough, wheezing or coughing up blood, breathlessness with paleness and fatigue, pointing to anemia, breathlessness with fever, pointing to infection, or coughing, choking, or breathlessness specifically with eating and drinking, pointing to a possible swallowing problem. So sudden or severe breathlessness, breathlessness with chest pain, blue lips, fainting, or choking that obstructs breathing, is an emergency, while new or worsening breathlessness on light activity, or with the various accompanying signs including the eating and swallowing ones, warrants seeing your doctor promptly. This is a symptom to act on. Let me explain why becoming breathless on such light activity deserves attention so clearly, because I want to be honest that this is a symptom to take seriously. Breathlessness on light activity, like talking or eating, rather than only on real exertion, suggests a significant limitation in your breathing reserve, and it's a symptom that points to important conditions of the heart, lungs, or blood, which matter and are often very treatable, with treatment that can substantially improve your breathlessness and your outlook. Catching heart failure, COPD, asthma, anemia, and the like, and treating them genuinely helps, while leaving them undetected lets them progress. And the swallowing dimension of breathlessness with eating is a safety matter worth identifying because of the risk of food or drink getting into the lungs. So becoming breathless on talking or eating deserves attention precisely because it suggests a significant limitation, points to often treatable conditions where catching them helps, and can touch on swallowing safety. And because the alternative, writing it off as just aging or being unfit, risks missing something important and treatable. This isn't about alarm. It's about recognizing that breathlessness on such light activity is a meaningful symptom worth evaluating, so a treatable cause can be found and addressed. And so let me give you what to do and what you can do, because finding the cause is key, and there's also much that helps. The first and most important step is to see your doctor about new or worsening breathlessness on light activity, like talking or eating, to find the cause because it so often points to a treatable condition of the heart, lungs, or blood, or to a swallowing issue. The doctor will ask about your breathlessness, when it happens, how it's changed, and accompanying symptoms like swelling, cough, chest discomfort, fatigue, lying flat breathlessness, or coughing and choking with eating. Examine you, listening to your heart and lungs, and do tests, which may include heart tracings, blood tests, including for anemia, breathing tests and imaging, and, if swallowing is a concern, a swallowing assessment, often by a speech and language therapist. Then, crucially, treating the underlying cause, the heart condition, lung condition, anemia, or swallowing problem, is what addresses the breathlessness and protects your health, and these treatments often help substantially. Alongside, depending on the cause, not smoking is genuinely important, managing weight helps, gradually rebuilding fitness helps if deconditioning is a factor, and managing any conditions well keeps your breathlessness controlled. And for the swallowing side, a speech and language therapist can assess and help with safer swallowing. So see your doctor to find and treat the cause, which often helps substantially, alongside not smoking, weight and fitness measures, and good management of any conditions and any swallowing issue. Let me say a bit more about the eating and swallowing dimension, because it's important and specific. If your breathlessness comes specifically with eating, and especially if you cough, choke, splutter, or feel distressed while eating or drinking, or have a sense of food going down the wrong way or sticking, that points to a possible swallowing problem, which matters genuinely because when the coordination of breathing and swallowing is impaired, food, drink, or saliva can enter the airway and lungs, risking choking and a kind of pneumonia from material getting into the lungs. So breathlessness with eating that comes with coughing or choking is worth mentioning to your doctor specifically as a possible swallowing issue, because a swallowing assessment, often by a speech and language therapist who specialises in swallowing, can identify the problem and provide strategies and modifications, the right food and drink textures, positioning, and techniques to make eating safer. So if eating specifically leaves you breathless with coughing or choking, raise the swallowing question with your doctor, because it's a safety matter that can be assessed and helped. This is one more reason breathlessness with eating deserves a proper look, beyond the heart, lung, and blood causes. Let me paint you a picture of how this commonly plays out, because it shows why checking matters. Picture a man in his 70s who's noticed he gets out of breath just talking, having to stop mid-sentence to catch his breath, and feels winded eating his meals, and who's been writing it off as getting older and out of shape. But becoming breathless on such light activity suggests a real limitation, and in his case, it's heart failure developing, which would progress if undetected. When he sees his doctor, perhaps prompted by also noticing ankle swelling and fatigue, the heart failure is diagnosed and treated, easing his breathing and addressing the underlying problem, substantially improving how he feels, a treatable condition caught and managed. Now in other versions, his breathlessness might be COPD, caught and managed, or anemia, found and treated. And if his breathlessness with eating came with coughing and choking, a swallowing assessment might identify a swallowing problem and provide strategies to make eating safer, protecting him from food getting into his lungs. In every version, getting it checked was right, finding and treating an important cause, or addressing a swallowing issue, rather than writing off a meaningful symptom as just aging. And in an urgent version, sudden severe breathlessness with chest pain, or choking that obstructed breathing, would be an emergency. That's exactly why breathlessness on light activity, like talking or eating, deserves evaluation, and why the warning signs deserve prompt or emergency care. And let me speak directly to those of you caring for or close to an older person, because this is a meaningful symptom, easy to write off, and you can help ensure it's taken seriously. You might notice a loved one getting out of breath while talking, stopping mid-sentence or becoming winded while eating, perhaps coughing or choking during meals, and attributing it to aging or being unfit. You can help by understanding that becoming breathless on light activity, like talking or eating, suggests a real limitation and deserves checking, because it so often points to treatable conditions of the heart, lungs, or blood. And that breathlessness with eating, especially with coughing or choking, can point to a swallowing problem that's a safety matter. Encourage a prompt doctor's visit rather than letting it be written off, and be alert to the accompanying signs that point to the heart, ankle swelling, fatigue, lying flat breathlessness, to anemia, paleness and fatigue, and to swallowing, coughing or choking with eating. And very importantly, know the emergency signs and act immediately. Sudden or severe breathlessness, breathlessness with chest pain, blue lips, gasping, fainting, or choking that obstructs breathing. Helping a loved one take breathlessness on light activity seriously and get it evaluated can catch and treat important, often treatable conditions, address swallowing safety, and, by recognising emergency signs, be life-saving. Let me draw this all together. Getting out of breath while talking or eating, things that should take no real effort, is a meaningful symptom worth taking seriously, because becoming breathless on such light activity suggests a significant limitation in your breathing reserve, pointing to often treatable conditions of the heart, lungs, or blood, and because breathlessness with eating can also touch on swallowing safety. It happens when limited heart or lung capacity, or anemia, means even the light demands of talking and eating exceed your reserve. With eating adding the factors of digestion, breath-swallow coordination, and a full stomach, and sometimes reflecting a swallowing difficulty. The leading causes are heart conditions like heart failure, lung conditions like COPD and asthma, and anemia, all treatable, alongside deconditioning, weight, anxiety, and, for eating, swallowing problems. So new or worsening breathlessness on light activity, like talking or eating warrants, seeing your doctor promptly to find and treat the cause, while sudden or severe breathlessness, or breathlessness with chest pain, blue lips, fainting, or choking that obstructs breathing, is an emergency. Treating the underlying cause often helps substantially, and the swallowing dimension of breathlessness with eating can be assessed and helped by a speech and language therapist. So here's what I'll leave you with. First, understand that getting out of breath while talking or eating is a meaningful symptom, because becoming breathless on such light activity suggests a significant limitation in your breathing reserve, and so often points to treatable conditions of the heart, lungs, or blood, and shouldn't simply be written off as aging or being unfit. Second, know the leading causes: heart conditions like heart failure, lung conditions like COPD and asthma, and anemia, all treatable, and, for breathlessness specifically with eating, the possibility of a swallowing problem. Third, see your doctor promptly about new or worsening breathlessness on light activity to find and treat the cause, and be especially alert to accompanying signs that point to the heart: ankle swelling, fatigue, breathlessness lying flat, to anemia, paleness and fatigue, and to swallowing, coughing or choking with eating. Fourth, raise the swallowing question with your doctor if eating specifically leaves you breathless with coughing or choking, because it's a safety matter that a speech and language therapist can assess and help with strategies for safer eating. And fifth, and crucially, know the emergency signs and act on them immediately: sudden or severe breathlessness, breathlessness with chest pain, pressure, or tightness, blue lips or face, gasping, fainting, or choking that obstructs breathing. Breathlessness on something as light as talking or eating is a meaningful symptom worth taking seriously, because the causes often matter and are often very treatable, and because it can touch on swallowing safety, so the wise course is to get it evaluated rather than write it off. So take care of yourself, take breathlessness on light activity seriously, get it checked promptly, and act immediately on the emergency signs. And because finding and treating the cause require a doctor, and because some breathlessness is an emergency, please treat new or worsening breathlessness on talking or eating as your reason to see your own physician promptly, and the emergency signs as your reason to seek immediate care rather than as a substitute for that care.